Hi, my name is Rebecca. I'm a nurse practitioner and I have ADHD. Growing up in the era that I grew up, they did not diagnose kids with ADHD unless they were the ones who were going absolutely crazy in the classroom. And that's not what my ADHD was like. I was the kid who sat quietly and had to shift around in my seat a lot. I still do that to this day, but I wasn't the one who was going bonkers and causing disruptions in class. So I flew way under the radar, but the signs were there. I was unable to complete any homework until the very last minute, even though I knew it was due and it stressed me out. I would be scribbling out my homework on the bus on the way to school in a mad dash at the last minute. When I did do homework at home, I had to sit, even before cell phones and streaming services and all this, I had to sit on the couch with the TV going, maybe a radio over there, to be able to focus. I had to have all this stuff going on to help me focus, oddly enough. I would lose papers, I would forget dates, I would struggle with deadlines, but somehow I made it through high school and graduated and got into college. And I decided I wanted to become a nurse practitioner. It took me 10 years of college. And when I hit college, the difference between high school and college was massive. If you have unmanaged ADHD, you can't get by on the skills you had in high school with the skills you need in college. It's just a much higher expectation. I can't be scribbling homework on the way to college on the bus. So I picked up some new habits. These are my little organizational tools, and they still help me to this day. I have to keep lists, I have to keep a calendar, I have to obsessively check my notes, but it does help. But there are still days when I struggle. And being in healthcare means that now I'm responsible for other people. So I can't miss deadlines. I can't screw up. It's someone else's life in my hands if I do something wrong. So it's really important to me that I have the skills to be able to function well at my job. It was actually in college when I realized what I had had all of these years was ADHD. We were learning about it, learning how to diagnose it, learning about the process, and it dawned on me that this is what had been wrong for all of those years. And I've just been kind of piecing together strategies to be able to survive. But once I knew what it was, I was better able to deal with it. There's a lot of resources out there, and I was better able to put together systems that help me stay organized and on top of things. Despite all of the things I have in place, there are still days when I struggle. And I decided to look at what else is out there, because the world has opened up in terms of medicine and evaluation for ADHD. So that's when I found FasTreat, and it's an affordable platform that will quickly, not the 2-month wait at the doctor's office, send you a survey, evaluate you, and if it's necessary, provide treatment for your ADHD. And to be honest, as a provider myself, this is how medicine should be. It should be friendly to the patients. There should be support around your diagnosis. There should be a rapid response to what's going on with you. You shouldn't have to wait until you're at the age of 50 to actually get some help.